Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about allergy. Now we have the monsoons and the cold climate have come upon us, and because of that many people are sneezing and their noses are blocked. After this happens for some time, they run to the nearest clinic or hospital and they demand antibiotics. Most of the time this is not due to an infection at all. If there is an infection, either viral or bacterial, there will be fever and the temperature will be more than 100.4. Also, if it is a viral infection, the secretions from the nose will be very clear and no antibiotic is going to cure that. If it is a bacterial infection, the secretions from the nose are yellow or greenish in color, and also there is fever. In that case, antibiotics can be taken. Do not take antibiotics by yourself because they worked for you last time or because your neighbor recovered taking those medicines. Also, don't go to the pharmacy and ask for antibiotics. They have to be given in a particular dose for a particular length of time to be effective. Otherwise, your body will become resistant to that particular medicine. This stuffiness and blockage of the nose occurs in cold climates because as the cold air enters the nose is convinced that it is being attacked by something and it starts to secrete mucus to protect itself. This mucus causes blockage of the nose, and after it stays there for some time, it can get secondarily infected. Sometimes people have a stuffy or blocked nose the entire year around, even though there is no obvious precipitating factor. This may be because they have pets in the house and the skin flakes of the pets go into the air and then enter the nose and cause this. It may be because of the house not being cleaned properly. Vacuuming is better than sweeping because sweeping stirs up the dust. If the house is not cleaned properly, the dust mites go and settle in the mattresses and in the curtains, and they cause a lot of allergy. Some people are allergic to certain medicines or peanuts, sesame seeds, or some other things which they are not very conscious of. So very often it is possible to identify these allergens by keeping a meticulous record of what is going on. Once the nose is stuffy and you find that you have an allergy or you think you have an allergy but you don't know what it is, you can do allergen testing. And after they inject little bits of the allergy causing compound into your skin, they will be able to diagnose what is causing the allergy, and after that they will be able to desensitize you to it. Also, if you live in a house where there are smokers or mosquito repellents are being used, these vaporizing compounds are very poisonous and cause a lot of sneezing in people who are susceptible. If you have a stuffy nose, sneezing, and you want to cure it without going to the doctor, one of the things you can do is to prevent this from happening by doing pranayama in yoga regularly. Secondly, you can take steam inhalations twice a day with plain water. The hot steam cleans out your nasal passages and removes the allergens. You can take antihistamines. In the olden days, the antihistamines made people very drowsy and were difficult to take. But now the newer compounds do not cause drowsiness but also clear up the nose. Nasal drops can be used. The safest are the steroid nasal drops, which reduce the inflammation and clear the nose. They do not produce side effects because they are not absorbed, remain in the nasal passages and do not get into the body. Saline drops can be used, but they only wash out the nose and do not reduce the inflammation, so they have to be used every 2 hours. Chemical nasal drops are very effective and they clear up the nose immediately, but they are habituating, and finally they may cause rebound congestion where the nose is more blocked after you use the drops than they were before, and they also have to be used more frequently to get the same effect. Do not smoke and do not go near anybody who smokes. Do not use mosquito repellents and try to exercise regularly. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. Thank you.